Hello, everyone, and welcome to USMMA EMS Training Online. Today, we'll be talking about patient care reports. What is a PCR? It is a patient care report. These forms are required by New York State EMS agencies as a tool for documentation. It gives you a sheet that has numbers and titles and different information that you must require to be filled out in order to give a full patient assessment and report for our agency and hospital care. When to write a PCR? Let's just go ahead and say anytime you roll out the bus, anytime you have patient contact, by request, and a 9A. Even if you do not find a patient, you will write a PCR, and also for standbys and events like football games and PKTs. Header, starting from the top and moving left to right, we have the date, that is the month, followed by the day, and the year. Run number follows a year, month, and then number per that month. So if it's the first call of the month, you write 01. And then ID. Make sure you're filling out every box. So we'll put 000MM1. Run number, this is a log. So like I said, it follows the year, month, and number per that month. These are some examples. So if you'd like to pause the video and look at those further, you may. Header, so agency, USMMA EMS, dispatch information. Just literally quote what the dispatcher says. Location, so if it says Rogers Hall or whatever hall, Murphy Hall, Tombfield, whatever. Location code 2944. If you don't remember that, it is posted on the ponies all around the PCR boxes. You have mileages, ending, beginning, and then total to make sure you know how far it was and how far the ambulance went. This is mostly good for patients with all male crews and a female patient so that you say, I took them to the hospital, and that is it. So just cover your butts and make sure you're writing all this stuff in. This is inside the bus from the driver's point of view. We have vigilant radio at the top, bus keys. Below that, we have the USMMA EMS radio. And then to the right of that, we have the loudspeaker, intercom, mileage, and run number logs. These are the times. So remember, 21, it's en route to the scene. 22 at the scene, 21H from the scene to the hospital, 22H at the hospital in service 18, and in quarters is 13. So you'll write those numbers appropriately in the boxes. Patient information, name, first and last, address, typically 300 Steamboat Road, and everything that goes with that. Here are the information, and here is it filled out. See how in the example, all of the boxes are either filled in with a 0 or have lines through them. This is important so no one can go back and write any misinformation in your PCR. Call location. So I doubt anyone is on a farm, but you can bubble in any of those if you see that they are residential within Patton would be health, or recreational maybe on Tombfield Road, just in the middle of the road. So 9A is emergency, non-emergencies, and standbys are like PKTs and football games. Body of the PCR. Physician, care in progress. This could be a midshipman. This could be Kings Point Police. This could be a company officer. Mechanism of injury. If they fell, struck by a vehicle, even just physical activity. Extrication, this is more so for motor vehicle accidents. CPO is required. Motor vehicle. Chief complaint, exactly for the words of the patient. And subjective assessment, what the patient tells you and what happened in that initial patient contact. So Feinstein, I broke my leg, and unit responding, general age, male, patient, complaining of blah, blah, blah in this position. So a sample is subjective. Everyone responded to a 21-year-old male found supine on a pool deck, complaining of 9 out of 10 pain to left leg approximately 5 minutes prior to EMS arrival. Patient states he was getting out of the pool quickly when his foot slipped and his leg got caught in the ladder. Patient claims to have felt a popping sensation below his left knee. Patient in care of lifeguard Sharp prior to EMS arrival. Patient denies any other injuries. Body of the PCR includes presenting problems. So for this patient in particular, we have 9 out of 10 left leg sharp bruising pain. And also we bubble in the fracture and circle that. So there's an array of different type of presenting problems. So go through that, make sure you bubble in all that apply for your patient. Allergies, we have penicillin for this particular patient, and below that is current medical list. To the right of that, we have our vital signs. So you'll write the time, rate, and quality. And you can see here, you put the SpO2 of that patient. You can put that right below the pulse, or you can write it in the comments section. So, but typically I like to write it right below the pulse rate, in between the quality down below that. Blood pressure, level of consciousness, A and O, so alert, verbal, voice, pain, unresponsive. Glasgow Coma Scale. And note that the Glasgow Coma Scale is on the back of your PCR, so you can use that to notate what the patient is. Is it their eye movement, their verbal and motor skills, or motor response? If they are less than 15, you are required to write out all 3 levels of the Glasgow Coma Scale and note it in the PCR. Pupils, see here. Skin, you have an array of options. And status, we have critical, unstable, potentially unstable, and stable. I would argue to say that no patient is stable if they are calling EMS, but it is up to your discretion. RMA, only one set of vital signs is required for an RMA, so don't have to waste too much time getting 2 sets of vital signs for a patient that wants to RMA. So we have our objective and comments. So what did you observe? Signs, decap BTLS. This is like everything else in the patient. And then the comments below. This is an example of an objective assessment. Patient is A&O, or alert and oriented, times 4 plus, meaning it is the patient has it. It has an open airway and a patent, plus lung sounds clear, positive and equal bilateral chest rise, plus radial pulses strong, plus regular, no difficulty breathing. They have circulation, motor, sensory in all 4 extremities. C-spine is cleared with no pain upon palpation or spontaneous movement. There is no jugular vein distension, no tracheal deviation, no loss of consciousness, no dizziness, no nausea. Positive, pupils equal and reactive to light. It did feel lightheaded, and they were bleeding, oozing from a 2-inch superficial laceration on anterior lower left leg, plus obvious deformity, positive swelling to left tibia, positive tenderness and pain upon palpation. As per patient, positive crepitus, which is that sound of bone kind of crunching together. In MM1, patient condition change, plus cool, pale, and diaphoretic, so they have that shock. O2 administered at 12 liters per minute with non-rebreather vital signs monitored. A sample of a comment section would be lifeguard Sharp manually stabilized patient's leg. Upon arrival, EMS directed Sharp to maintain stabilization while bleeding was controlled with sterile 4x4 gauze pad and a 4-inch cling pressure dressing. Lower left leg immobilized with splint and cravats with positive circulation motor sensory to all 4 extremities. After application, cold pack applied, patient moved to ambulance on stretcher, seated in position of comfort. Patient transported without further incident. Body of the PCR says treatment given. So patient was moved on the stretcher, oxygen delivered, limb immobilized, and cold given. Patient transported with head elevated at position of comfort and wrapped with ACE bandage. So also review all these in depth if you make sure you get all bubbled in that apply to your patient. If you don't document it, it didn't happen. The last part of the PCR is the disposition section. So you'll say, if you transported him, you will say North Shore University Hospital, Manhasset, and the disposition code is 705. There's other, so like RMA is 005. If you transfer to Vigilant, it is 004, and you can have one of the ALS providers sign the back of the PCR. And then standbys are 007, my favorite, number 007. So transfer to another agency, yes, 004, obviously. For the crew, we have all the crew members in charge, crew chief, driver, and then techs and riders can be below. Fill in the names and all that apply. Signatures, so if the patient refuses medical assistance, they will sign this, the back of the PCR, patient signature, and a witness. Try and get a faculty member be that a teacher, a company officer, or whoever you can. Typically, we don't try to do midshipmen because we're all together and we don't really have a say, but whatever. So try and get a company officer if you can. And for being a hospital representative, giving it to a nurse or physician, have them sign the hospital receiving agency. Remember RMA, commit this to memory or write it down, but please note all the protocols related to refusing medical assistance, and then this is the bus route for getting the patient. If you'd like further driver training, we can go with that, but thank you, and have a good rest of your day.